Zang, The Organ System of Traditional Chinese Medicine by Jeremy Ross, page 211, Part 4, Clinical Practice, Chapter 17, Clinical Methods. The concern of this book is not with theory for its own sake, but with the application of theoretical principles in clinical practice. The practice of traditional Chinese acupuncture in the People's Republic of China is based on the clinical application of the following basic theoretical framework. Yin-yang, substances, 8 principles, Jing, disease factors, and Zangfu. Such clinical procedures as the choice of diagnostic questions, the study of pulse and of tongue, and the choice of acupuncture points and methods of points use are performed according to this basic framework. For example, the classification of the 28 pulse qualities is according to this theoretical framework, and on any particular pulse pattern is studied in these terms. Hence, a thin, rapid, wiry pulse may represent deficient heat, injury to Jing, and disharmony of Gan. However, the aim of this chapter is not to give an exhaustive description of clinical techniques, as this is given elsewhere, but to give an understanding of how the theoretical principles discussed in the previous chapters affect clinical practice. The three basic areas of clinical practice are diagnosis, treatment, education of the patient. Diagnosis. The first stage of clinical practice is diagnosis. Information is gathered in three main areas: observation, interrogation, pulse, and tongue. Observation, interrogation. It's from this method that practitioners of TCM gain most information, and it is upon this method that they most rely. It is considered to be a more important source of information than pulse or tongue. The techniques of observation, interrogation, to see, to hear, to ask, to palpate, to smell, are familiar in the West and will not be described here, but the concept of asking key questions will be emphasized. An inexperienced practitioner may ask dozens of questions and remain confused. An experienced practitioner may cut straight to the heart of the matter with a few key questions. This is an ability that comes only with complete theoretical understanding of all the patterns of disharmony and from many years of experience of the various permutations and combination of these patterns in clinical practice. Three examples of the rapid resolutions provided by key questions are given below. 1. A confusing complex of gynecological signs was resolved by asking the question, is the pain before, during, or after menstruation? The answer that pain was mainly before menstruation indicated that the predominant pattern would probably be a stagnation of qi. Pain, mainly during menstruation, is more likely to be due to stagnation of shui, and pain, mainly after menstruation, to be associated with deficient qi and deficient shui. 2. In the case of menorrhagia, it was difficult to decide whether the predominant system involved in the disharmony was Gan, Pi, Remai, or Chongmai. The key question was there a period of heavy physical labor just before the start of the menorrhagia? Since the lady answered that she had moved house just prior to the start of the problem, P was likely to be the predominant disharmony. Excess work may injure P, resulting in loss of the ability of P to hold shui in shui mai. 3. A patient complaining of sore throat with raised temperature and fast pulse was asked the question, you have the thirst, but do you want hot or cold drinks? Since the answer was that the patient had no preference for hot or cold, the diagnosis was that the predominant factor was deficient in. It was therefore not enough to remove the heat from the throat. It was equally important to support the in. Generally, Thirst with desire for cold drinks indicates excess heat. Thirst with no preference for hot or cold drinks indicate deficient heat, and thirst with no desire to drink may indicate accumulation of internal dump. Desire for warm drinks, though not necessarily with thirst, may indicate accumulation of cold in the body. Pulse. Due to inadequate information on TCM in general and on pulse diagnosis in particular, many misconceptions and misunderstandings were incorporated into early teaching of pulse diagnosis in Britain. Hence, the TCM pulse diagnosis that is practiced in China differs greatly from that which has been taught in British schools of acupuncture in the past. As stated above, the purpose of the method of TCM diagnosis, observation, interrogation, pulse, and tongue, is to gather information in terms of yin-yang, eight principles patterns, disease factors, substances, Jing and Zang. Chinese pulse diagnosis has little concern with the five phases. Its purpose is to determine, for example, whether the disharmony is of yin or yang, of heat or cold, of deficient qi or deficient shui, of pi or yang, of invasion by wind cold or invasion by damp, and so on. Position and depth. TCM pulse taking in China is in terms of the five Zang, Shen, Pi, Gan, Xin, and Fei, and not in terms of the six Zang, since Xinbao is included with Xin. Also, relatively little importance is given to the food systems, which are generally incorporated into their paired Zang. Hence, in contrast to the early British acupuncture pulse diagram of table 17.1 that used in China is as in table 17.2. In the latter figure, there is no clear separation between Zang and Hu. Xinbao is not regarded as a separate pulse, and both right and left hand qi positions are occupied by Shen. Western schools of acupuncture used to teach that there are two depths, superficial and deep, corresponding to Fu and Zang respectively. There is some truth in this, and that the Fu may be considered as a yang aspect of the Zang. But the Chinese approach to pulse taking also includes a very different approach to depth, involving three depths: superficial, middle, and deep, which in some applications may be regarded as corresponding to qi, shui, and jing, respectively. Qualities and quantities. The Western preoccupation was with the six pulse positions, each at two depths, giving 12 locations in total, and consideration of pulse quality were given secondary importance. The predominant Chinese concern is with the 28 pulse qualities and with the three depths, and secondarily with the six positions corresponding to the five Zang, although these are also of importance. With a very large number of combinations of pulse qualities at three depths and six positions, the possible permutations are enormous. This very flexible system allows classification of illness in terms of yin-yang, eight principles patterns, disease factors, substances, and zongfu. Also, it was the habit in the past in the West to describe the pulses not in terms of qualities but quantities. Each of the 12 zangfu would be marked plus, minus, or normal, and balancing would consist in draining energy from a plus to a minus. The author has never seen this approach used in clinical practice in China. Another important note is that in TCM, the pulses do not generally relate to Jing law. They relate to the Zangfu in terms of the substances, eight principles patterns of disharmony, and disease factors. Obviously, if a Zang is affected, its channel may also be involved, but the particular pulse pattern relates to the state of the Zangfu and will not register changes in the channel alone. So, in summary, the Chinese first the Chinese first observe the overall pulse qualities at each of three depths, and then at each of the six positions. They are looking for information in terms of yin-yang, eight principal patterns of disharmony, disease factors, substances, and Zangfu. Pulse patterns of some common disharmonies. Since the pulse qualities are described in detail elsewhere, this section concentrates on a brief outline of some of these key disharmonies. Generally, in disharmony, Shen pulse tend to be deep, since Shen rules Jing, which is associated with a deep level of the pulse. Pi pulse tends to be empty, since it is often associated with deficiency of qi and shui. Also, since Pi and Wei form shui, Pi is often linked with the middle depth. Gan tends to be wiry, since Gan governs smooth, even, unobstructed movement of qi. And in disharmony tends to be associated with obstruction of qi flow. Shin tends to be intermittent, since the regularity of the heartbeat determines the regularity of the pulse. And Fei tends to be superficial, partly because Fei deal with qi, which is associated with a superficial level of the pulse, and partly because Fei is the uppermost Zang, the most open to invasion by external disease factors. External wind is also associated with the superficial pulse, since external wind often represents the first stage of invasion, affecting the outermost areas of the body. These pulse patterns are only generalizations and, for example, a wiry pulse does not necessarily indicate gun disharmony, nor does summer heat always produce a superficial and empty pulse. Analysis of combinations of pulse qualities. Pulse qualities rarely occur singly. They usually occur in combinations. Indeed, many qualities may be present. The art and science of pulse diagnosis is to determine clearly which quality or combinations are present, and of these, which are predominant. The next step is to interpret these qualities, or combinations of qualities, in terms of yin-yang, eight principal patterns, disease factors, substances, and Zangfu. Few pulse patterns are ambiguous. For example, the combination of slippery and rapid might indicate the presence of damp and heat, or it might indicate the presence of flame and fire. And the thin and choppy pulse might indicate deficient shui, deficient jing, or deficient jingye. Other signs would have to be considered to determine which pattern was predominant. However, despite ambiguity, there is a clear logic in the analysis of pulse combinations. For example, some of the common combinations of the GAN disharmonies are shown in Table 17.4. Obviously, there are other possible interpretations. For example, for some Ds, for example, wiry and slow may indicate pain associated with stagnation due to cold, not necessarily associated with GAN disharmony, but these patterns form a useful general guide. Tongue. The tongue can give information on the origins, seriousness, and likely progress of the disease. Changes in the body or in the coat of the tongue can aid this diagnosis and prognosis both initially and throughout the course of the treatment. For example, a tongue that is pale, moist, and slightly flabby indicates a better prognosis than a tongue that is very pale, very moist, and very flabby. Also, if before treatment the tongue were red indicating heat, and after treatment became normal, it would indicate treatment was successful. If, however, during treatment the tongue changed from red to scarlet, it would indicate heat injury had become more severe. and either treatment was incorrect or the situation had changed and required a different treatment. The tongue is less labile than the pulse and cannot give the same breadth and depth of information. However, like the pulse, it gives information in terms of eight principles, patterns, substances, jiangfu, and disease factors. Also, like the pulse, it does not give information in terms of the Jing alone, but in terms of the jiangfu. Since the study of the tongue in TCM has only been recently introduced into the West, there are fewer misconceptions regarding it than regarding the pulse. Tongue patterns form some common disharmonies. Since study of the tongue is dealt with elsewhere, this section merely gives an outline tongue patterns for some basic disharmonies in order to illustrate the basic theoretical framework that underlies tongue diagnosis. These are only guidelines. For example, deficiency is not the only origin of the thin tongue coat, which can also indicate normality or invasion by external disease factors. Conversely, deficiency might lead to internal accumulation of food, phlegm, or Jing, resulting in a thick tongue coat. Tongue patterns would never be used in isolation, only in combination with information from observation, interrogation, and pulse, both of which are considered more important than data from tongue patterns. And B. The tongue pattern that is sometimes described as swollen or puffy, sometimes having scalloped edges and tooth marks. The apparent imprints of the teeth is termed flabby in this book. This tongue pattern is usually associated with deficient qi, deficient yang, or the accumulation of jing. Very roughly, the body of the tongue may be divided into areas corresponding to the five Zang, as in figure 17.1. However, phenomena on the center of the tongue, for example, do not necessarily imply P and Wei disharmonies, any more than P and Wei disharmonies necessarily register only at the center of the tongue. Nevertheless, it can be a useful guideline. For example, red dots along the side of the tongue may accompany the relatively chronic gan and dan disharmonies. But it's necessary to remember that this may also represent acute condition of invasion by external wind. Analysis of combination of tongue characteristics. Like pulse qualities, tongue characteristics rarely occur singly, more usually in combinations. Again, gan disharmonies are taken as an example, as in table 17.6. It can be seen that the information given by the tongue is less specific than that given by the pulse. There is no tongue characteristic equivalent to the wiry pulse quality, which is generally present in all gan disharmonies, so that in some cases the involvement of gan in a pattern of disharmony cannot be decided from the tongue alone. For example, a purple tongue merely indicates stagnant shui. It would be necessary to check pulse and other clinical data to determine whether or not this stagnant shui were associated with depression of ganqi. Summary. The three main diagnostic techniques in order of importance are observation, interrogation, pulse, and tongue. All three are used together to provide as clear and detailed a picture of the patient's pattern of disharmony as possible. Differentiation of patterns of disharmony. Clinical practice is based on the successful differentiation of the pattern of disharmony involved in the patient's illness. In TCM, disharmonies are characterized in terms of yin-yang, eight principles, disease factors, substances, Jinluo, and Zangfu. The information from observation, interrogation, pulse, and tongue is considered in these terms. For example, a female a female patient complained of chronic restlessness and insomnia, recurring mild headaches in the temporal region, and premenstrual tension aggravated by stress and irritation. She had a wiry, thin, slightly rapid pulse, and tongue which was red, especially at the side. This information was organized as follows: yin yang and eight principles. The condition was probably internal rather than external, since it was chronic and not acute. The slightly rapid pulse and red tongue with no cold indicate the condition was one of heat rather than one of cold. However, the mildness of the headache and the thin quality of the pulse indicated a deficient rather than an excess condition, and the fact that the pulse was only slightly rapid indicated it was deficient heat rather than excess heat. The combination of the red tongue with no cold and thin, slightly rapid pulse indicated an inefficient condition rather than a yang deficiency. In summary, it was a chronic internal condition of deficient heat, otherwise known as deficient yin. Disease factors. The red edges of the tongue could have been due to acute invasion by wind heat, or they could have been associated with disharmony of gan and dan. The latter was more likely, since this was a chronic condition with such signs of gan involvement as headache and wiry pulse. The precip- precipitating factor may have been predominantly emotional, since the premenstrual tension was aggravated by stress and irritation. In summary, the disease factors may have been predominantly internal, associated with emotional disharmony. Substances. Some deficiency of Jing may have been involved in the indeficiency condition, since there was sign of both deficiency and overheat. For example, thin, rapid pulse, and red tongue. Also, some disturbance of Shen may have been involved in this insomnia and restlessness associated with blazing on fire affecting Shin. In summary, deficiency of Jing and disturbance of Shen were the two most likely patterns of disharmony of the substances here. Jinluo and Zangfu. The first question was whether this illness involved Jinluo only, or whether Zangfu were also involved. Since pathological changes were registered on pulse and tongue, Zangfu must have been involved here. This idea was reinforced by the presence of such chronic internal signs as changes in the menstrual cycle. That the Dan channel was involved was shown by the location of the headache, but this was predominantly a Zangfu rather than a Jinluo pattern. The second question was concerned with which Zangfu were involved. The wiry pulse suggested Gan and perhaps Dan. The headache suggested Gan and or Dan. And the temporal location of the headache suggested Dan. The third question was which pattern of disharmony of Gan and Dan was involved. The premenstrual tension suggested hyperactive ganyan, as did the headache, and the thin, slightly rapid pulse and red tongue with little cold suggested the hyperactive ganyan was associated with deficient gan-yin. In summary, in this pattern of disharmony, Zangfu predominated rather than Jinluo. Specifically, it was deficient yin and hyperactive yang of gan, with involvement of Dan Jinluo. This woman's illness could therefore described as a condition of deficient internal heat originating from emotional disharmony involving deficiency of Jing and disturbance of Shen, and termed deficient yin and hyperactive yang of gan with involvement of Dan Jinluo.